Let me just say that I'm going to focus on two things today. Much of what I've been working on in the last 24 hours are kind of things that are going to happen in the future. But there are two really important things that I feel an obligation to address and hopefully give some relief to people who are in need of it. First of all, let me address unemployment, the unemployment compensation system. Right before I walked in here, I finished a call with the Ohio Department of Job and Family Services leadership, the CIO and the technology leadership of the state, and the vendors, the private sector vendors that support that system. I was very clear to them that the governor and I, our members of Congress, the legislature, our mayors, and the public in general have been communicating with us that some of them, many of them, have frustration getting through on the system. And I wanted to convey throughout the system, people are doing this, that folks out there are scared about both the health and the economic consequences of what's going on, and that we wanted to bring even greater sense of urgency to solving some of these challenges. I was reassured that the capacity of the system has been increased 20 times on the website, 20 times the capacity on the website. They've added 100 employees to the call center. And I said to them, that's not enough. We got to do more. And I was reassured that the vendors are adding capacity so we can take more phone calls, that they're going to put 180 new people, training them up to put them in the call center. And this is important to know because you can't just put anybody in there. This is a complicated system that has to comply with the rules and regulations outlined in state and federal law, and they need to be trained to do this right. And that also the Bureau of Workers' Compensation system is in the process of training and lending some of their employees to this effort. But the reason I'm bringing this up is because for all of you who have had challenges, I want you to know your voices are being heard and they're being acted upon. I also feel the obligation every time to reassure you that even if you have trouble, your benefits will be backdated to the date that you were eligible to receive them. The folks who are doing this, the ODJFS team on unemployment compensation who are on the front lines, when you get through to them, understand they're not the problem. They are working so hard to try to serve you. Don't express frustration to them. What they need are better tools. They're on the front lines. We need to give them better weapons, better tech tools, and more reinforcements. And we have ordered those reinforcements to the front lines to help them in the work that they are doing. But you also need to know, I think it's important to know that the system is working for most. As a matter of fact, to put this in perspective, I tried to think of a way to explain just what those folks are facing as they're trying to do this. And if you take the last 2 weeks, really since this has all picked up steam, they have handled twice as many people in 2 weeks as we typically have on average in the entire unemployment compensation system over the past 2 years. That just gives you a little insight into what has happened over that 2-week period. As Dr. Acton, I thought, thoughtfully said yesterday, there is no system in the world, no hospital system in the world that's designed to handle what we're dealing with. Well, our unemployment compensation system's the same way. It's just that they are not having time to prepare for the surge. The surge is now. And so they have been tasked with deploying a larger build out of that system. We ask that you be patient and understanding and know that they understand the sense of urgency that's involved here, and they are deploying even more resources than they already had toward solving this problem. So I wanted you to know that, wanted you to hear that, and understand for those of you who are experiencing some challenges that action continues to be taken to address it.